Well, I'll start. So I think for me, and I know for Kimmy too, we're both working from home. And one of the reasons that I was kind of relegated to the home place was that I wind up being in high risk categories. So that was, just kind of a non sequitur with our administration, and Kimmy as well. So we've scrambled to try to figure out, not being present, how we could actually be impactful to our team. And there are a significant number of providers that, our Holtz Children's has worked out to have rotating folks on the front lines to try to minimize exposure on the whole. And they've really done a bang up job across the board with the pediatric residency program, our faculty members, and all of our ancillary providers. Some of us who are technologically incompetent had to really ramp things up with the Zoom, which has been incredibly helpful. We've been fortunate that our department chair has kind of sent out regularly. First of all, it was twice a week, and now down to once a week, just with information about what's going on in the hospital, what's going on in the community, and at least trying to stay as possible. I think the void that I feel personally is I'm a hands-on person, and it is really tough to try to feel that there's an interaction staring at somebody through the computer screen, and yet compared to just talking on the phone, it's definitely better. So what we have attempted to do is, with Kimmy's help, and I'll let her speak about that, we've kept up our resiliency meetings with whoever wants to Zoom in. We've kept up with our weekly interdisciplinary PD-PALS meetings to try to run through our census of patients that are on it. And we've availed ourselves if anybody from the staff has anything to speak about.
I think it's also been super clear how connected the families do feel to us. We've been lucky enough that the families we're closest to haven't been admitted. The units have really scaled back with the amount of inpatients. But I mean, especially with the few that we have right now, Dr. Cantwell has been their go-to, but that they're comfortable with calling us in a moment's notice and just calling straight to our cell phone rather than, expecting us to come to the bedside. So, I mean, although it feels very strange that we're not seeing them in person, I don't think we've missed a beat as far as continuing to be supportive of them, whether it's directly with them or with the team, because it's really nice to see that they're very comfortable reaching out to us, if needed, whether they're inpatient or outpatient.
Do you have, has the hospital got a policy about how many family members can be in the room with a child, and is that proving problematic at all, or?
From what I've heard, parents have been very willing to go along with those rules. It's one parent per patient right now. I mean, they could switch, but they recommend the same person per 24 hours. When the kids are sicker, and if they're declining in status, they have made exceptions where both parents can be there. The very few COVID patients that we have as well, there's been exceptions made where the families can come in and be with them if there's an issue going on. So, but the parents, especially a few weeks ago when all this started, you could tell that there were a lot of additional stressors, not only being there with their child in the hospital, but trying to get their other kids up on their virtual schools and dealing with their college-age children who are now coming home from school. We had one that had to quarantine because they came from New York. So she had her family split all over the place because she's got her child in the hospital. She has her child home from college who needs to quarantine. the husband's trying to stay away from everybody so he can continue working. So it's definitely been a challenge, but we haven't faced any families really trying to fight that rule, as far as I've heard.
And it's definitely specific for pediatrics, because in the adult side, you know, they've been very limited. And what I believe that we had heard from our neonatal ICU is they got a little bit more directive with defining intervals of times, because they wound up having, you know, a lot of people coming in, which was extremely stressful for the staff. So they scaled it back a little bit, but for their unit, it works a little bit better because the infants are kind of in more pods than the private rooms that we're fortunate to have in the ICU. And one of the things, as Kimmy was talking, that I find very challenging, and I kind of chuckle about this, because on one of your videos, Dr. O'Malley kind of made an inference that, well, we got the team together. Well, we got most of the team together. I have found that so challenging to do remotely. And we have had it for several reasons. Number one, it's hard to keep up with what's actually going on in real time with the patient, because of course the notes always lag behind the decisions that are on RAMs. It's so much easier to actually listen in to what's going on RAMs than to just talk to one person. You know, you might get the resident or the fellow or the attending, and to get a sense of what everybody feels is going on with the patient, including the bedside nurses. And we were quite successful in winding up doing some inpatient telehealth that I tagged along with our child psychology team, so that we were actually able to really sort of squash some of the angst that was going on with one particular, just a really challenging case that I think really helped the team try to get kind of a collaborative management plan.
Kimmy, I was going to ask you too, what do you, in the family, I don't know, we hear from our colleague again that many families have chosen to, you know, really stay at home, sometimes not let their nurses in, you know, not, they love them, but the fear of COVID is so high that it's really tough. And the moms are becoming the full-time nurses again, and the mom, I don't know if you're hearing the same thing.
I mean, there's one family in particular that has done her weekly check-ins now with me. And I thought it was actually funny in the beginning of this, probably, I guess about a month ago now, she had texted me not just about the what ifs if her child needed to be admitted, but then what happens during hurricane season a few months from now if all of this is still going on. And, you know, at first I kind of laughed. I was like, let's just take it one day at a time. But then I thought about it that, you know, this is somebody that has had her own system that's so different than what we have from a day-to-day basis, but has had such routine and structure that now everything has kind of fallen out of place for them. And, you know, she never really had home health to begin with. She was that full-time nurse and mom to her child. But, you know, the convenience of going to the clinic to get what she needed, or, you know, to not wait for, you know, to do an online meeting with somebody. And then, you know, to kind of have her plan in place. And then also to understand that if her child were in the hospital, her life would pretty much be there while he's there. And then when he's home, it's at home. And now everything's kind of shook up again. And so I was, as I was talking to her, I was kind of, it hit me that, you know, I think her thinking even months in advance is just her way to help control as much as she can of the situation by planning things and organizing things. But yeah, I mean, a lot of our families don't have their nurses coming in anymore. So, you know, one of the things that we struggle sometimes with our population is the parents that don't come visit while they're at the hospital, or that really do strongly rely on nursing care, that, you know, we have to keep reminding these families that it's important to learn about your child's care too, in the case that your nurses can't show up or school is closed, or, you know, whatever it may be. And it's a huge adjustment and learning curve that I can't even begin to understand, especially with, you know, maybe having other children at home and a job and, you know, everything else that comes along with it. So their whole world is just completely knocked upside down right now. I've also struggled a lot too with just not being there. I think, you know, Patti and I are so used to jumping in and rolling our sleeves up if we need to help at all. And even one of the nurses last night texted me and she's like, it's just so strange not to see you. And, you know, that's what I've been struggling with the most, is just, you know, thinking about the past disasters that we've had, the earthquakes, the hurricanes. You know, we've always been doing something to help. And it just feels very distant from, you know, I think we're still doing the best that we can. But I still feel very distant from what is actually going on. So, you know, a lot of people will call me for advice about, you know, medical stuff or what's going on, and think I know, you know, I have an insider scoop. And, you know, I say, just like them, I don't know. I'm learning as you guys are learning, and I'm taking the same precautions. And it makes no difference whether, you know, I'm a medical person or not right now. I think we're all in the same boat.